The land is sacred. We're all visitors to this time, this place. Good morning. My name is Carl Bauer. I'm here today to present a system thinking approach in public health, which is about improving health literacy for Indigenous relating to tobacco smoking through a systems thinking approach. Now, before I begin, I would like to share my experiences about working in a rural community as an emergency generalist. I'm currently working in Western New South Wales, where the Indigenous people dwelling there, and health inequity is one of the main issues in the health system. Now, Tain and Friends in 2020 confirmed that an essential part of Indigenous sacred practices of the ceremony, funeral and unique social utility is smoking tobacco. Now, this will not change, and why the tobacco smoking is challenging in the Australian public health system. Now, my presentation today will provide a background of problems that I found from a review of the relevant literature, study framework, aims, and a system thinking application. Engaging with Indigenous people and justification will be described. The group activity will be conducted to learn how to apply the system thinking tool into practice. In Australia, Indigenous population experience lower life expectancies. They're affected by the inequity of health from access to health services, remote areas, socioeconomic status, and low health literacy. These social determinants of health are defined as challenging, complex issues. Indigenous tobacco smoking is ranked second of the high-risk behaviours for chronic diseases over 50 years. Now, let's look at the picture. Now, tobacco use in the Indigenous population is higher than non-Indigenous by around 3 times, even though the smoking rate has dropped to 8.6%. Tobacco smoking celebration is part of their culture and belief in their communities. In 2019, a survey found that Indigenous people were smoking more than 2.9 times than non-Indigenous, particularly higher in the rural and remote areas. A lack of appropriate health promotion approaches for Indigenous people, where they're faced with multifactorial health inequities, results in levels of health literacy being poorly understood. Now, this situation is a leading cause of health burden on the system. But what about health literacy and tobacco use in Indigenous? In Australia, health literacy remains a persistent challenge among Indigenous communities, impacting both individual well-being and community development. Health literacy is dynamic, and it combines with individual and systems-based health environments through policies, processes, materials, and people. Therefore, improved health literacy will lead to better choices to improve the health of our socially disadvantaged, especially Indigenous people. So why a system thinking approach is crucial for these complex issues? Systems thinking is a very important method of providing timely and adaptive support and interventions. This is especially the case for Indigenous people who live in complex rural and remote environments from varying cultural and linguistic backgrounds. There are many stakeholders in the issue of smoking cessation, including the producers of tobacco products, individual concerns, healthcare providers, family members who may experience passive smoking, and other organisations. A systems thinking approach identifies all stakeholders concerned across time periods, which is complex and adaptive to allow flexibility in response to any changes. Understanding the complexity of health literacy with integration of a systematic thinking approach provides effective health services and supports better decision making in promoting healthy behaviours. Now, this study aims to develop the health literacy interventions, improving Indigenous tobacco smoking rates through systems thinking approaches. and identify the effectiveness of health literacy interventions for Indigenous tobacco smoking using a system thinking approach. This study is conducted applying systems thinking applications as seen in the picture. Now, learning organising theory, system dynamic modelling method, and causal loop diagrams as a tool. We know that system thinking approach allows sustainable approaches with long-term effects and benefits, such as increased life expectancy with reduced morbidity and mortality. Let's move to the system thinking application details. Now, here are some more details of system thinking applications. Now, let's look at causal loop diagrams in detail. Here's an example of causal loop diagram of smoking cessation. Now, adopting a system thinking approach can provide a comprehensive and effective strategy for addressing the root causes of lack of health literacy and developing sustainable solutions. Now, the study will be using the research framework as shown in the slide. Now, there are three processes of system thinking approach framework. Firstly, now factors that facilitate this situation are engagement, communication technique, cultural and language, location and settings, and health media. Then we move to the process applying system thinking applications for health literacy and smoking cessations, which is composed of stakeholders, resources, government and policies, community and healthcare providers, and working group. Now, how do we know that system thinking approaches work? Evaluation and outcomes will be assessed by the smoking cessation rates, health outcomes, consumer satisfaction using a survey, interviewing, and health checks. This framework will provide smoke-free and improved quality of life in Indigenous people. Now, how do we engage with Indigenous people? A key aspect to the engagement process with Indigenous community leaders, council, community members, and organisations is to use flexibility and adequate time allocation. So 5 key components. So stakeholder engagement, community-based solutions, education and health literacy development and training, education and health literacy empowerment, and health and wellbeing. These will be applied combining AIHW engagement techniques. Now, here is an example of chat tools. Let's look at some details, such as how difficult for you to understand the information of your health. Now, understanding tobacco use in Indigenous people relates to their health literacy. To improve their health outcomes requires the public health system and other services cooperate, which increasingly leads to consider the concept of a system thinking approach through multiple lenses. Now, system thinking provides new opportunities to understand the effectiveness of intervention and improve Indigenous health. This is your chance to apply into your practices to transform your health services. Now, time to apply your experience into system thinking approaches by using causal loop diagrams tool, as we previously learned together. Now, look at the causal loop diagrams example in the slide. Now, you guys and girls make a group of 2 people and read the case study provided, and then brainstorm and discuss a system thinking approach into practice. Now, we've got 10 minutes for discussion, and after 10 minutes, we're going to share our causal loop diagram outcomes. Learn and share together. Now, sharing makes the world better. It's time to learn and share your group discussion about causal loop dynamic tools. So we're going to have 3 minutes for each group to share your experiences of how to apply systems thinking applications. Your experiences are very important to improve the health services. Now, why is a system thinking approach the best option to address this complex issue? It's a dynamic approach that is required to address knowledge gaps in health literacy. To address smoking cessation amongst Indigenous, which is the #1 modifiable lifestyle factor responsible for mortality, can help to address other important factors such as culture and language and environmental factors. Now, developing information changes initiatives in complex social environments, requires a system thinking approach to evaluate knowledge translation initiatives in primary health care. This study has not been undertaken previously and makes it an important study. Finally, system thinking allows flexibility to address all factors that may not be obvious and dynamic to facilitate improving health literacy in Indigenous people. Now, in order to achieve the optimum outcomes, there are 5 recommendations that need to apply into smoking cessations. Firstly, ensuring cultural sensitivity approach applies into practice. Reinforcing tobacco control policy. Thirdly, laws designating smoke-free zones. Incremental tax increases as financial disincentive to purchasing tobacco products. And build and maintain network relationships and knowledge capacity. System thinking has been identified as one of the 4 revolutions by World Health Organization that are guiding to transform the healthcare system. So in conclusion, tobacco smoking in Indigenous people is challenging as it can be defined as a complex issue. Many interconnects and interpersonal relationships components require adaptive, dynamic systems to address. A systems thinking approach allows flexibility to address all factors to create a more dynamic design and evaluation system intervention for Indigenous. It's often encouraged the involvement of different stakeholders, ensuring that policy development remains collaborative, transparent, inclusive, and democratic. Better understanding of the complexity of the social determinants of health, applying systematic approach, will improve quality of services and outcomes. So system thinking can assist to bridge the gap between health literacy and tobacco use in Indigenous people. Thank you very much.